I think the COVID-19 is a common enemy of the human being. Owing to its high reproductive index, it's impossible to be well under control. So if COVID-19 remains spreading by any of the countries in the world, so that's the point. We need to have to join together. So to end this spreading in the world, any decisive action taken by the policymakers must be based on science and evidence and the best clinical trials. So when my greatest fear will be is politicization of the measure to protect public health problems. So that's my greatest fear.
My fear is that we will not adhere to the lessons learned. One of the problems that we have had in our approach to global health is that when you have a particular crisis, you respond to it and say, what we need to do is learn lessons for the future. But then when the future comes, we lose our corporate memory and we don't do the things that we need to do. What is very clear right now is that we have to maintain the spirit of solidarity, cooperation, and collaboration and build, global health security agendas and networks so that we're all in it together, every single country. And we prepare in a way that we've learned the lessons that were really very painful lessons that we learned from this outbreak.
We need to have more experience to be exchanged from each other to improve the manufacturing of the vaccine. So that's my great hope in dealing with the public health problem, just like dealing with the climate, just like dealing with the air pollution. We're the same goal to deal with that. So the cooperation and together is very, very important.
We have been successful in the past by global cooperation with smallpox, with polio, with measles. There's no reason in the world why we cannot do the same thing with COVID-19 by a combination of cooperative public health measures and the application of science to get interventions in the form of vaccines and therapies and other types of interventions.